This is Kathy Knipfer, Instructor for Nursing 2333, recording the Managing Nursing Care lecture for Chapter 26 on Delegation and Art of Professional Nursing Practice. Delegation is an art and a skill of professional nursing practice. It is multifaceted, it is a decision-making strategy. It's implemented to improve the work performance of staff in the healthcare organization. It's also implemented to achieve nursing goals and improve patient care outcomes. To delegate effectively, the nurse must understand the art of delegation. The nurse must also develop critical judgment skills and apply delegation decisions in clinical nursing practice. Let's look at delegation from a historical perspective. Due to the increased complexities in healthcare, the need arose for unlicensed nursing personnel to help nurses provide high-quality patient care. The NCSN in 2005 identified educational preparation of UNPs, including how to receive delegation from nurses. The American Nurses Association in 2005 outlined the principles of delegation for registered nurses, and then revised the principles in 2012. Delegation is defined as the transfer of responsibility for the performance of a task from one individual to another while retaining the accountability for the outcomes. This was defined by the American Nurses Association in 2012. It was defined by the NCBSN in 2006 as the act of transferring to a competent individual the authority to perform a selected nursing task in a selected situation. And then together, these two organizations defined it as the process for the nurse to direct another person to perform nursing tasks and activities. And that was in 2006. And here's a diagram of the delegation framework to achieve care outcomes. In 2006, the American Nurses Association and the National Council of State Boards of Nursing describe delegation and authority. They state that it resides within the Nurse Practice Act of each state. It examines the value of the unlicensed nursing personnel in patient care delivery, and it also declares the importance of delegation decisions is safety and welfare of the public. To perform effective delegation skills, the nurse must understand the Nurse Practice Act of his or her state. The nurse must also understand the delegation standard related to individual job descriptions. The nurse must understand the policies of the healthcare facility and function within their state's regulatory guidelines. Let's go over some key terms for delegation. Responsibility refers to the reliability, dependability, and obligation to accomplish work. It's a two-way process that's allocated and accepted. Accountability determines if the actions were appropriate and provides a detailed explanation of what occurred. Authority is the ability to perform duties in a specific role. Each individual is obligated to perform to the best of his or her ability and at a quality level. Let's go over some other key terms related to delegation. Legal authority, by virtue of the RN's professional nursing license, is the ability to transfer selected nursing tasks or activities to a competent individual. Supervision is defined as the provision of guidance and oversight of a delegated nursing task. Open lines of communication must occur between the delegator and a delegatee to eliminate any misunderstandings. Organizational accountability requires that the organization provide adequate resources and appropriate nurse to LPN or nurse to unlicensed nursing personnel ratios. Delegation decisions can be based on multiple factors. One would be the patient's condition, another is the complexity of the task to be performed, and then the predictability of outcomes. Some factors that complicate the delegation process related to the delegatee would be age, gender, and ethnicity. The 5 rights of delegation include the right task, it should be appropriate and legal, the right circumstance, it should be the appropriate environment, resources, and equipment, the right person who is willing and able with the expertise, the right direction and communication, instructions should be clear and concise, the right supervision, where monitoring and evaluation takes place. Key elements must be considered while assessing the ability to perform the work. They include safety, critical thinking, stability, and time. Let's talk about improper delegation. There's improper follow-through when the delegator fails to provide clear and concise directions related to the assigned task or activity, or when the delegatee fails to report results or findings related to the assigned task. So there has to be communication. You should review the diagram on the slide of the delegation process. This, this diagram is also in your textbook. Delegation complications. Information decay is when the patient's health status changes rapidly and specific information is no longer relevant to the patient's condition. Information salience is when the quality, meaning, and clarity of the information is clearly understood by the delegator and the delegatee. Let's look at Hersey's situational leadership model. Hersey's model describes 2 factors that need to be assessed to determine the level of the follower's readiness, and those would be ability and willingness. The ability relates to knowledge and skills in a specific situation or job readiness. Willingness relates to the individual's attitude, confidence, and commitment, or the psychological readiness. This model also describes the style of leadership that's required of an effective leader and its relationship between task behavior and relationship behavior. That would be the amount of guidance and the amount of support that is needed in a given situation. Leaders and managers need to behave differently in specific situations. Let's review the delegation process. The delegator should state exactly what is being delegated and the expected outcome. They should convey the authority to perform what is expected and identify priorities. They should acknowledge monitoring activities that may be performed and specify any performance limitations. The delegator should specify deadlines, including the exact times if appropriate. The delegator should specify report timeframes and data expected, and specify deviations, including when immediate action must be taken. The delegator should identify appropriate resources, including individual consultants. And the delegator should emphasize what may not be delegated and ask delegatee to provide examples. 21st century delegation goals. They are to delegate and supervise safe patient care, evaluate the effectiveness of delegated tasks, Maintain accountability for safe, competent, and effective patient care. Acclimate to new advances in health care. And be an effective delegation decision maker. Let's look at the term assignment. It has two meanings. It can be the work an individual is responsible to accomplish during the work period, or it can be a transference of responsibility and accountability among RNs. When an RN assigns to another RN, responsibility and accountability are transferred. When the RN delegates to an LPN or an LVN or a UNP, responsibility is transferred, but accountability remains with the RN. It's very important that you read through these chapters and apply them to nursing practice. Make sure that you understand the concepts that are in these chapters.